Study tours abroad are hugely useful for care executives. Firstly, they take you out of your normal working space, which gives you an opportunity to reflect and think about what you are doing at home and what you might like to do differently. Secondly, they bring a great richness to both the people who are on the tour and the people that they're visiting, who benefit enormously from understanding how systems work in different countries.
I think in the UK we still have a care system which is relatively rigid and actually probably has its roots in how the social care and healthcare system was set up more than 50, 60 years ago. And I think we're going through a period now where people are more interested in looking at options in terms of funding, in terms of provision, in terms of integrating some of the disparate funding streams that previously were probably not integrated enough under one umbrella. So I think part of the challenge in the UK right now is going to be to find solutions that A, customers really want, and B, the customers can afford.
The differences between social care in the different countries is very useful, especially when there's an aging demographic in the UK, which means they're slightly ahead of Canada for us. It allows us to learn from things they've already experienced and integrate new models that they've tried and have succeeded in Canada. So it allows us to be proactive based on what I'm seeing.
Over the various stage tours, we've been able to really have a look, particularly at small community living models of residential aged care. And that's certainly, I guess, not only improved the way we're looking at building our residential aged care services and also servicing and staffing them in the future. But I think one tour actually probably prevented us building a facility that would have probably impossibly been outdated by the time it was completed. So I think the tours have really opened our eyes to possibilities and certainly changed the way we are practicing within Mercy Health in Australia, both now and going forward. Much more for the better. Yeah.
Another one of the themes throughout all of the visits were the customer service. Instead of calling kitchen staff or catering staff, they were butlers and butler staff, and that really set the scene for the delivery of service and the quality of service all of the providers provided over here. So that's something I'd like to look at replicating in Australia.
The Sage trips are extremely well organised. They're very professionally run by Judy. She keeps everything under control. Once you've booked and paid for your trip, she looks after everything from that moment on. You get to spend all of your time focused on what you're here to learn and to study, and you don't need to worry about any of the day-to-day things that happen. Transport, food, missing items, whatever it is, Judy will look after it for you.
Sage initially started as an initiative for Australian aged care executives, but over the last few years what we have done is gone global. We have other countries wanting to come to Australia, and we have countries wanting to share. The recent trip to the UK, we had a delegation that comprised Canadians, New Zealanders and Australians, and we're very proud of that. We've now had inquiry from the British sector wanting to come to, or down under, to the Southern Hemisphere. We have French delegations that now want to visit Australia. We have European delegations that want to visit the United States, Canada. So yes, we've gone global. Sage has gone global. We have interactive all over the globe.